These are the learning objectives for this lecture. At the end of this lecture, the fourth year MBBS student should be able to describe the structure of the basement membrane of the skin, enumerate various types of bullous skin disorder, differentiate between inflammatory and non-inflammatory bullous diseases, and describe their morphology and pathogenesis. When we attempt to classify skin disease, we can classify these diseases on the basis of the site of origin or the anatomic structure that is involved. One group is disease of the epidermis, and that include ichthyosis, diarrheal disease, psoriasis, and pemphigus vulgaris. Another group is disease of basement membrane zone, that is the dermal epidermal interface, and this include epidermolysis bullosa, bullous pemphigoid, dermatitis herpetiformis, erythema multiforme, systemic lupus erythematosus, and lichen planus. The inflammatory diseases of superficial and deep vascular bed include urticaria and angioedema, cutaneous necrotizing vasculitis, allergic contact dermatitis, granulomatous dermatitis, sarcoidosis, and granuloma annulare, while scleroderma is the disorder of the dermal connective tissue. The panniculous inflammatory disorders are erythema nodosum and endoretum, while acne vulgaris is also an inflammatory disorder. Then there are infections such as impetigo, superficial fungal infection, deep fungal infections, viral infection, and arthropod infestation, and variety of benign and malignant tumors. Some skin diseases are also affected or also manifestation of the paraneoplastic syndromes. Then there is another way to classify these diseases, and this is done on the basis of the process, the pathologic process or morphological appearance of the lesion. One is the epidermal maturation disorders, and it includes ichthyosis. Then acute inflammatory dermatosis include urticaria, acute eczematous dermatitis, and erythema multiforme, while chronic inflammatory dermatosis include psoriasis, seborrheic dermatitis, and lichen planus. The bullous or blistering diseases of the skin can be divided into two groups: inflammatory blistering disorder that include pemphigus, bullous pemphigoid, and dermatitis herpetiformis, and non-inflammatory blistering disorders that include epidermolysis bullosa and porphyria. The disorders of the epidermal appendages are acne vulgaris and rosacea. Panniculitis is the group that includes erythema nodosum and endoretum, and other types of panniculitis are also there. Then disorder of pigmentation and melanocyte, freckle, lentigo, melanocytic nevus, dysplastic nevi, and melanoma, and benign and malignant tumor along with adnexal tumors of the epidermis and dermis. The classification schema for the tumor of epidermis and dermis for this series of videos shall be under these heads: the benign epithelial tumors that include seborrheic keratosis, fibroepithelial polyp, and epithelial or follicular inclusion cysts. There are a number of adnexal tumors. Then premalignant and malignant epidermal tumors that include actinic keratosis, squamous cell carcinoma, and basal cell carcinoma. Tumor of the dermis include benign fibrous histiocytoma and dermatofibroma and dermatofibrosarcoma protuberans. Tumor of the cellular migrants into the skin are mycosis fungoides, that is cutaneous T-cell lymphoma and mastocytosis. Then there is plenty of cutaneous paraneoplastic syndromes that include acanthosis nigricans, dermatomyositis or polymyositis, and Sweet syndrome. The benign epithelial tumors arise from the keratinizing squamous epithelium, the keratinizing stratified squamous epithelium of the epidermis, hair follicle, and cutaneous glands. Biopsy is required for their diagnosis, and they may be sometimes diagnostic or telltale sign of some syndromes or visceral malignancies such as Cowden syndrome, in which there is presence of multiple trichomomas, while Muir-Torre syndrome is associated with presence of multiple sebaceous neoplasms.